Welcome to the weekly checkup. We're brought to you by Georgia Urology. I'm your host, Dr. Bruce Feinberg. And there are few areas of healthcare that have had so few advancements, get so little attention as does mental health. It's been talked about in this country for decades now. So many of the social ills that we face are directly related to mental health and recognized as such, whether it's gun violence, suicide, opioid addiction, substance abuse, the list goes on and on. And mental health is always discussed as a root cause. And yet so little attention is paid to it. So little support from a public health perspective is paid for it. And now we have the pandemic. And the crisis in public health, particularly in mental health, that the pandemic has created and will continue to create. Because starting to be at the point now where half the country is vaccinated and those who are vaccinated can no longer have to wear masks, doesn't end the problems that the pandemic created. And so we're going to focus today on mental health in America. We're going to focus a lot of that conversation on children and family who have suffered the most as a result of the pandemic impact and the closing of schools, and are often at the center when it comes to opioids, when it comes to suicide, and substance abuse, and the list goes on, and gun violence even. So much to talk about as we focus on a topic that we just don't cover enough. And I'm thrilled today to have the folks from Hillside back with us. Hillside mission since I think it's 1888. We'll get that confirmed. So 1888 has been to help children and families thrive by providing outstanding residential and community mental health services. Hillside provides specialized cutting-edge behavioral treatment and education to children and their families. Hillside is led by Emily Acker. She is the president and CEO, serving since 2014, and has served children and adolescents for over 30 years in a variety of nonprofit organizations. And with her today is Gaan Akers, who serves as clinical education and referral relations manager. She's a licensed professional counselor and national certified counselor. Learn more about them and the organization at hillside.org. That's hside.org. And give us a call, 404-872-0750. Share your experiences, ask your questions. The experts are here, 404-872-0750. So, Emily, good to have you back. It's been a long time since we had you on the show, and no time more meaningful, more pressing than right now.
Absolutely. Thank you for having us back. I hope that in this next hour or two that we can be helpful to your audience.
Well, I don't know how you can't be. If just by shedding light, just by understanding, by normalizing and removing stigma, it just, if nothing else, it's the line that I love and I've used, which I think actually was coined by Socrates, although I think it's been credited to Freud and others, but something along the lines of a life not examined is a life not lived, or a life not examined is a life not fulfilled. But we've all got issues. Not all of them rise to the level that require formal counseling, although I guess some would argue that everybody would benefit from counseling, but certainly in terms of the health crisis, there are tens of thousands and millions of Americans who would benefit from help. And certainly we want to see more awareness, and hopefully with more awareness, there'll be recognition, and the hearing of the cry for help will lead to policy changes, investment, the things that are necessary to hopefully turn the tide. All right, so let's start with a little bit about Hillside before we get into kind of the things that you've observed and some of the stats around, what's been going on pre-pandemic and how the pandemic has inflamed things. So does Hillside really go back to 1888?
Hillside really goes back to 1888. We were founded by caring and active women in Atlanta who saw a need to help children and families. And through the years, we have evolved as needed to meet the most pressing demands. So over time, we have served almost as an orphanage, which you may remember way back in the days when families, not because they didn't want to, but because of various circumstances, couldn't raise their children well, safely, appropriately. And so sometimes they were sent to Hillside to grow up and be supported while their families improved their situation and could bring them back home. And then through time, we have become more and more of a specialized psychiatric facility, adding dialectical behavior therapy as our program model, and making sure that we are a very strong group of professionals that can really help children struggling and help their families and help both head toward healing and maintain a life worth living.
And it's both residential and outpatient?
Hillside has a variety of services. So we started as a residential program where children would come and live with us and have very intensive therapy, 24 hours a day, 7 days a week. And since we've expanded, so now we have intensive in-home therapies where our licensed professionals are going into families' homes to help them and help their child regulate, different symptoms of mental health, different behavioral needs, and create a safe and effective home environment. So we'll go into the home 2 to 3 times a week and really help strengthen that family system. We also have a day treatment program where kids can come to our Hillside campus in Midtown Atlanta 5 days a week, almost like attending school, but it's very intensive DBT skills building, social skills building, and psychiatric care. We also, as a result of the pandemic, created a virtual intensive outpatient program so that kids throughout Georgia who weren't able to drive to the Hillside campus to get help can have help 4 days a week virtually with our licensed therapists. And this has been a highly effective intervention, like I said, for the many who do not have access to appropriate counseling services in their home counties or hometowns. So we've really expanded our continuum so that we can meet families and children where they are and address their most pressing needs.
So I don't know if this is for you or for Gaan, but how many families in the past year have you directly engaged with and helped?
Well, we count the number of children we serve. So we've served over 700 children in the past year. And then with those children, there's obviously a whole network of families, siblings, fathers, mothers, aunts, uncles, grandparents. We all know that a child requires a whole system in order to be strong and to thrive and to be healthy. And so you're never just serving one individual, you're serving the whole system. But we certainly count the individuals or the clients that we have really focused our care on. So over 700 this year.
So when you're dealing with children, it seems to me, and maybe false assumptions, but that so often their problems are related to problems of other members in the family and in the home. And so will you extend that service to the others, or do you bring in partners? So let's just say dad's an alcoholic and there's, so that the child is expressing the effects of that trauma, but you're not going to, I don't know how well you fix it if you can't start to address the root cause. So how does that work?
Absolutely. Like I said, it takes the whole system. So when a child is in any of the services at Hillside, there is family therapy and family skills building involved. And through that process, we're looking at what does the home base look like? What other problems may be in existence in that family? We are always going to partner with other providers, other professionals who can provide whatever help the parents in the family, the caregivers in the family, the siblings in the family may need. Because, yes, the whole system has to be impacted. It has to be strengthened. There has to be safety. So safety is really important, teaching families what it looks like to have their home safe. We want to avoid any type of suicidal risk or anything that would put the family, the child, the parents, anyone at risk. And sometimes it's just a lot of teaching and educating. That's why our in-home program has been so effective, is because when you're in a home and you can see the setting and you can really work with the family in partnership to create a more healing and healthy environment, then everyone's impacted. So yes, we will partner with anyone helping that family. We will make references and certainly recommendations. We will partner with schools and teachers and churches, whatever's needed to really help that family function as a whole and healthier system.
All right, we've got so much to cover. It was great to get introduced to Hillside and the program. And I want to, as we get back, we're going to understand both how families in need, get to work with you. But I also want to then, dive into COVID and, again, what was pre-COVID in terms of children mental health and how it's been, the issues that have been exacerbated, created new, and issues related to that. We have a lot more to cover. We'll be back. Help by the Beatles. Need I even say it? That's our song of the week. Send us the songs you'd like to hear, and we may start playing them as early as next week. We're back on the Weekly Checkup. I'm your host, Dr. Bruce Feinberg, and we're live today with Emily Acker and Gaan Akers of Hillside, which provides community mental health services to children and families. Learn more at hside, that's capital hside.org. And join us in the conversation, 404-872-0750. Let me remind you that our show is produced by Lens, Atlanta's healthcare marketing experts. And with that, I'll also introduce Gaan Akers. Gaan serves as Clinical Education and Referral Relations Manager at Hillside. And Gaan, after hearing Emily do a really nice overview of the program, I'm sure that people listening know someone and want to know, how do we get access to the programming? So how do patients come into the system?
Yes, and thank you for having me. So one really unique thing about Hillside as well is that we specialize in working with young people who are needing a slightly higher level of care than your typical outpatient services. I think with mental health, it's really difficult to navigate the system because people don't know what the system is. I oftentimes take phone calls from parents and say, hey, I really want my kid to come to Hillside. And I would ask, have they ever been in any treatment before? And they say, no, not really. So what Hillside does is that we generally work with children and adolescents and families who have tried at least regular outpatient therapy first. They normally have a therapist or a psychiatrist they've worked with, and they're continuing to struggle. They're not making progress in once-a-week therapy. So most of Hillside clients for clients who are being referred by the professionals they are working with. These are the therapists and the psychiatrists who are seeing them and saying, the once-a-week therapy session is not quite enough to stabilize or giving enough relief or making enough progress. Hillside could be the next step in treatment that can give some intensive services, whether that's coming in the home or having the kids come to do an intensive outpatient program online or coming in person for a day treatment program. So for most of Hillside's kids and the families access services through a clinical referral.
And so that telephone referral is coming from the family. It's not only referred from other professionals.
Families often call, and sometimes we're able to say, oh, yes, an intensive outpatient program or intensive in-home program could be really helpful. And then we can, work with the family and start services that way. But for the higher levels of care, like residential treatment or a day program treatment where, kids are coming to campus 5 days a week, most of the time the families actually access services through a clinical referral from their outpatient provider.
Got it. Okay. So I think that's pretty clear on how that happens. And what's the typical number of referrals that come in on a month, in a month's time?
You know, what's really interesting is our admissions team field over, 200 calls a week for various
200 calls a week?
easily.
So
There
you're
is
turning,
definitely need.
so you're turning tons of people away. And that's because they're just not appropriate given where they are. I want you to hold that thought because we're going to go to break. And when we come back, tell me more about you're obviously handling, the excessive demand beyond what the supply of services you have. And let's talk about that. We're brought to you by George Urology. I'm your host, Dr. Bruce Feinberg. And today we're talking live with Emily Acker and Gaan Akers of Hillside, which provides community mental health services to children and families. Learn more at hside.org. Like Hillside, hside.org. And of course, give us a call, 404-872-0750, 404-872-0750. Emily, those numbers were staggering. You're able to take care of 700 children a year, and then all the extended family that's related to those kids. You're getting 200 calls, literally a week. That references demand. I have to believe that so much of that is directly related to the pandemic. Although again, the remarkable absence of a national mental health policy made this demand probably great even before the pandemic. But I want to get back to a little bit of understanding about what were the major deficiencies. And this is not political because this has been going on for decades across both political parties, whoever's been in power. But whether the stigma of mental health, whatever the issues are, but the deficiencies that existed in mental health care, and then what has become even more pronounced with the pandemic.
Yeah, the stigma is real, and we have been working for years to help fight that stigma and make discussions about mental health part of everyday communication. What we really work with families on is that this is not taboo. It should not be secret. Anyone who's struggling with mental health symptoms and challenges really needs to be able to openly discuss this, and families need to be able to reach out for assistance and support from their community, their loved ones, their churches, their support systems. So this happens to be a Mental Health Awareness Month, and we have done a lot of work to put information out there in our Reframe Mental Health campaign to hopefully promote discussions, promote communication, promote education, because the less we're siloed and the less we're isolated, the more help that is available to anyone who needs it. So yes, the pandemic has made things more difficult, especially in this past year when we had to be very, very careful about how we interacted with each other and how we had to social distance, and even wearing a mask where you can't see someone's facial expressions, their smile, their sadness, so many things hidden behind that mask has made it very, very challenging. Hillside was able to continue all of its services through the pandemic, and we are seeing an uptick in need, in calls for help, and we know that more is coming as people begin returning to school, returning to community, returning to events. I think we're just at the tip of seeing probably a greater need as we move forward the next few months.
Yeah, and I would like to add, too, that I've seen several articles coming across about how in the last year, in 2020, the number of reimbursement claims for adolescent mental health has roughly doubled from the year before in 2019. So we are definitely seeing this increased need in mental health services for young people. And one of the really important things as we talk about reframing mental health is that oftentimes we think of mental health solely in the negative sense, right? Even the examples we generally think of at the beginning is, people who are suicidal and extremely depressed and they're having issues with outbursts and violence. And we don't talk about mental health in terms of wellness enough. Emily and I were having this conversation the other day, and how oftentimes we forget to think about mental health and physical health being kind of linked and parallel, right? How oftentimes, if a child has a sore throat or they have a stomach ache, they know that something's wrong, and that's something that they come to their parents, they let people know, like, I don't feel well. We oftentimes don't have the same kind of criteria for our kids, or even for people in general, to say, you know what, how I feel about myself, it's not great. This feeling when I wake up in the morning and wishing that I wouldn't wake up, that's kind of not normal. And so people oftentimes don't think about mental health in those terms of, like, there are warning signs that's saying we're not doing as well as we should be. How do we feel about ourselves? How are we functioning in our relationships? Those are some of the clues and things that could help people start to be aware of their mental health and actually seek early interventions instead of waiting until things get really, really bad. A lot of the calls that we get are parents who are saying, well, yeah, my kid's been sad or been isolated for the last year and a half, but we didn't really think about doing anything until last week, then when they had some, suicidal thoughts. So there's kind of these levels of care in mental health that kind of parallels that as well. Going to regular therapy and just kind of getting a regular outpatient services kind of help maintain our mental wellness, our relationships, how we feel about ourselves, how we're functioning in day-to-day life. Could be that kind of first step in accessing mental health care.
I would comment too, at Hillside, you had mentioned the over 200 calls we get a week. Our team of admissions counselors are really good at listening to the needs and determining if Hillside is not the best option or an appropriate option for services, what services are helpful. So one of Gaan's primary responsibilities at Hillside is to be very well engaged and knowledgeable about all the other services in Georgia. So we are partners and good friends and colleagues with many professionals who provide a variety of mental health and emotional behavioral health treatment. And so often we are guiding a family to another resource if we can't be of service, or if they need something different, or if they're in a location that is not accessible to Hillside. So, all these calls we get, we're fielding very carefully. We are serving the families and the children who should be served at Hillside, and then we're giving them connections and referrals when those are needed, so that families can better navigate what is a complex and sometimes very confusing system.
Crazy. Sorry, bad choice of words. But I'm thinking about the fact that, if 200 calls coming in, the vast majority, you're serving as a navigator. You're not necessarily bringing them into the system. And
that's true. Yes.
Yeah. So it's a huge service you're providing for the community that you're kind of underwriting. And that's the part that I was saying was crazy from a business model. How do you support that? How do you continue to be able to provide that service? But the reality is there isn't that hotline. I was just having a conversation last night where our friends had witnessed someone on the street and trying to call. I think it's 311 or 313, the hotline for citywide. I think for mental health. And couldn't get a response, and so, but simple fact that you guys respond, and then you not only respond but navigate, you become kind of critical to the community. It's a huge value.
Yes. So, of course, our admissions counselors are helping the families who call navigate. And on the other end, we also work in conjunction with schools, and we work with school social workers and counselors. We partner with churches and people in the community to do education on mental health. I think, one of the things when I talk about there's levels of mental health care, and people are like, what do you mean? There's regular outpatient, there's more intensive services. Sometimes parents call us and they're like, my kid needs to come to Hillside because, they're really struggling. And I was, tell me more about what's going on. And we realized that they don't need to live at Hillside and be in a residential treatment. They can do really well in intensive outpatient services, where they can continue to deal with day-to-day stressors, go to school, deal with the sibling that you don't like very much, and also get therapy and be able to practice these new skills that you're learning in the real world. Ideally, we want kids to get early intervention so that we're stabilizing them and keeping things from getting worse. Also, it reduces a lot of suffering. Instead of struggling and being in emotional pain for a really long time, let's do something about that now so that we don't end up in a high levels of care like residential treatment or in a inpatient hospital.
Right. So seeing them, it's better to see them when they demonstrated signs of depression rather than when they had thoughts of suicide ideation, rather than when they actually attempted suicide. It's like you can start to see where the earlier the better, and why have that additional burden on them of having those other events, plague them, as far as the guilt and the other things that are part of that storytelling. So when we're going to go to break in a few seconds, and before we do, what I wanted to tee up is the role of primary education in school, because I can see where it could be a difficult problem in that, on the one hand, you're expecting socialization, and you might have a lot of adults who are partially trained or somewhat trained to recognize these issues, and so for early recognition. On the other hand, you're putting kids back in an environment with peer pressure, bullying, and some of the things which may provoke worse outcomes for them. And so something to think about as we go to break, kind of the role of school and how much value, the positive value, the negative value, and how is there something we can learn from that. So let's talk about that when we come back. This is the Weekly Checkup. We're live today with the folks from Hillside, Emily Acker and Gaan Akers. And we'll be back. We're brought to you by George Urology. We're today live in conversation with Emily Acker and Gaan Akers of Hillside, which provides community mental health services to children and families. Learn more at hillside.org. That's HSIDE, capital H, SIDE.org. And as always, we're taking your calls, 404-872-0750. That's 404-872-0750. All right, so Emily, the role of school, because I can see that it could track both ways. It's an environment where sometimes kids are bullied. They can suffer from the negative effects of peer pressure. On the other hand, you've got hopefully some skilled, trained adults who are another potential source of observation about these kids and maybe have certain insights that parents lack and see them in an environment maybe where some of these things are exposed. So what's that role, good and bad, of school, and how did the kids suffer or benefit during the pandemic?
Well, we've definitely had kids that have experienced both. For many children, the connectivity to their peers, to their teachers, to their PE teachers, all the different adults that engage with them in their school setting, having that loss has been tremendous. I've talked to many parents who have said their once very active and talkative and energetic children have become more sullen and more afraid of various social situations, and they've seen more shyness and have had real concerns about that change for their kids. Then there's other kids that we see at Hillside who have for years struggled with social anxiety. And so at the time that they could then move to virtual school and be at home and engage their teachers through a screen, it actually became very comfortable for them. So we definitely have very different needs, very different groups of kids. What is true is in either situation, a child needs to feel a sense of purpose. They need to feel like that they contribute to something. So whether that's, physically being in their school and engaging with their friends and teachers, or doing an online learning opportunity where they are gaining and growing and feel some sense of connectivity that way. It's whatever's comfortable to them. Certainly social emotional learning is vital in school settings, and resiliency is vital. Teaching kids that a bad few minutes or a bad decision doesn't need to mean a bad day. We can all be resilient. We can learn to use our skills and turn the day around. We just need the opportunity to shift things up and move forward.
So when we look at an upcoming school year that begins in the fall, where it's anticipated that all children will be returning to school full-time, unmasked, very likely, based on what's happening with the vaccines, do you anticipate that that's going to become, it's going to expose kids who were thriving in a virtual environment to more trouble? Or I guess it's going to do both. And so it's just, right. So it's going to be like kind of wait and see. When we come back, what I want to do is maybe help parents. What are there learnings? Are there mnemonics or, tricks, that conversations they could be having, ways they could gain more insight than they might have? So let's talk about kind of from a general mental health perspective, what should parents be doing? The kinds of conversations they should be having. And let's do that when we return. Checkup. I'm your host, Dr. Bruce Feinberg. This hour is presented by Georgia Urology's Kidney Stone Hotline. 1-855-STONE-11, available day or night for scheduling an appointment within 24 business hours. We're live today with the folks from Hillside. We're talking mental health, and there's no more important topic almost ever because of the crises that face this country, from suicide, gun violence, opioid epidemic, substance abuse. The list goes on, that these at their root are mental health problems. And we continue to really do sick care, which is managing the problems after they're formally manifest, rather than wellness care, preventing these problems by understanding their root causes. So that's what we're getting into today, and it's never been more apparent in terms of the need than coming out of the pandemic and the impact particularly on children. They're being in lockdown, out of schools, parents and children, often together much more than they ever had been before. Observations of kids' behavior, being sullen, other issues, and where do they seek help? What kind of help do they need? And that's the conversation we've been having today with the folks from Hillside. Hillside's been around since 1888. Its mission is to help children and families thrive by providing outstanding residential and community mental health services. They provide specialized cutting-edge behavioral treatment. That specific cutting-edge therapy is called dialectical behavioral therapy. We'll hear about that in this segment. With me today from Hillside are Emily Acker, who's the president and CEO. She's been in that role since 2014. And Gaan Akers, who serves as clinical education and referral relations manager. She's a licensed professional counselor. Learn more at hside.org. That's Hillside, capital hside.org. And of course, join the conversation. 404-872-0750. So a couple things I want to get into, and I want to start with understanding this specialized type of counseling, this dialectical behavioral therapy. And then I also want to be able to kind of from there segue into, given the need is so great, you're getting 200 calls a week, but last year you cared for 700, the most, I think, children you cared for ever. And you're not just caring for them, but their extended families. That's just not even their immediate families, but their further extended families, indirectly and directly. And so there is a huge need. And part of that is what can parents do on their own? What assessments can they make? What tools are available for them, to them? How do they recognize the problem so they can intervene early rather than late, rather when there is a suicide attempt or ideation? So, a lot to cover here. Let's start with, though, the type of treatment and why dialectical behavioral therapy. Who wants to take it?
I'll take it. So dialectical behavior therapy is an evidence-based treatment that is founded by Marsha Linehan in kind of the late 1970s, early 1980s. And it's really an adaptation of the cognitive behavior therapy, which most people have heard of, to really deal with adult women who struggle with chronic suicidal ideation and self-harming behavior. A lot of women who were diagnosed with borderline personality disorder. That's the origin of DBT, dialectical behavior therapy. However, since then, DBT has been adapted and used and studied with many different populations. And now it really is kind of the choice treatment for people who really struggle with mood dysregulation, people who have really strong, intense feelings, and they don't know what to do with that feeling, and they end up using ineffective coping behaviors to deal with those strong, unwanted feelings.
So are there certain pillars of this treatment that define it?
Yeah, so I'll start with dialectics. So dialectics is kind of this idea that, two things that might seem to be opposite can both be true. The major dialectic in DBT in treatment is to balance change and acceptance. We have to accept that this is life as it is right now. Life as it's being lived is kind of miserable, and we also have the ability to change that. And another dialectic that we see oftentimes in DBT is that people are doing the best that they can, and they have to do better. Because most of the time when you see someone who's struggling, they really are the best that they can in that moment with what they have. And in order for them to be in a different space, they have to do something better. And so DBT, helps people think, the dialectics help people think outside of the black and white terms. Right. A lot of times we become kind of trapped in our own thinking when we think that everything is just either or, black or white. And so DBT helps expand the way that we think about things in a both and kind of way, that, more than one thing can be true at once, even though they seem to be opposite. DBT is very skill-based. And so these are skills that we have a curriculum that Marsha Linehan started, and these skills are studied. And so we teach them in a very specific way. So we can't invent our own DBT skills. They're a set curriculum. And the skills in DBT covers really 4 main modules. The first module in DBT is mindfulness. And I know mindfulness is a big buzzword in the last few years. But really, mindfulness is just our ability to pay attention and become aware, being present in the moment without judgment, so that we can see.
All right, so I got to ask you. So when it became the buzzword, was that like killing you that it's been around for like decades and everybody should be doing it? And why is it all of a sudden something special?
Well, I think there was just a lot of coverage on mindfulness, and then, we saw like an onslaught of like apps like Headspace and all these kind of apps about mindfulness, and then people talking about mindfulness a lot. And part of it is because it works, right? Like people are finding that it's really helpful to practice mindfulness. And just like anything that is popularized, oftentimes, we kind of get a distorted version of it by just getting a snapshot. So we teach kids how to be mindful. How do we pay attention to, what is in the moment? Oftentimes, our distress comes from not being in the moment. It's either worrying about what's going to happen in the future or ruminating about some mistakes or some, bad decisions I made in the past. So in order for us to kind of cut down some of that anxiety and some of that, emotional distress, if we could just stop ruminating about the past, stop just worrying about what might happen in the future, and just be present in that moment. And so helping them be aware is the first module of DBT, and everything in DBT is kind of based in mindfulness. And so that's a really important skill.
And when you're developing these skills, these are skills that can be done whether they are inpatient residential living or whether they are being managed in their home in an outpatient way. The skill set and the training may be more intensive in versus out, but it's still the same that you're using, the same approach.
Yes, they're the same approach. They're the same skills. And, DBT can be taught at an outpatient level. I think the difference with DBT in our, higher levels of care setting, like residential or day program, is that it's built into their activities. We're making sure that they are having opportunities to practice these mindful skills, such as, we could just be eating lunch, but we can say, you know what, we're going to practice 15 minutes of mindful eating. Pay attention to the texture, to the taste of the food. Slow down. Don't just gobble it up and swallow. Just pay attention. Be present in the moment. And so mindfulness can be practiced in many ways. I think one of one of the misunderstanding about mindfulness then becomes, people think of only meditation, right? Like you have to sit in a quiet room and meditate. That's how you're mindful. But mindfulness can just be active activities. One of the things we do on campus is therapeutic drumming. And in drumming, one of the really great ways to practice active mindfulness. You have to pay attention to the rhythm, to what, is going on in the room, in the moment, in order to kind of stay on beat and do what you're supposed to. And so mindfulness is kind of the basis of DBT. The other skill modules that we work with, the next module is distress tolerance. How do we tolerate when life doesn't happen to go our way? Because life can have painful moments. And how do we survive those things? How do we survive this emotional crisis without making the situation worse? And so
Gaan, I'm going to hold you there. We've got to go to break. So we've got a good understanding, I think, now of DBT and the core module, which is mindfulness, and then we can touch on the other two when we come back after the short break. So once again, we're live with the folks from Hillside, and we're going to be back with Emily Acker and Gaan Akers. And we're back on the Weekly Checkup. We're brought to you by Georgia Urology. I'm your host, Dr. Bruce Feinberg. Our show is produced by Lens, Atlanta's healthcare marketing experts. And today we're live with Emily Acker and Gaan Akers of Hillside, which provides community mental health services to children and families. Learn more at hside.org. And of course, you have a chance to talk to the experts. Give us a call, 404-872-0750. All right, so Gaan, you were going into dialectical behavioral therapy. This is the core therapeutic modality that you're using at Hillside. You can use it both on your patients and residents, and as well as your those who are just in day program and even those at home. And you talked about there are 4 modules. The first of which is mindfulness. It's a much more comprehensive way of thinking about being in the moment. And then you were starting to go into the other 3. Let's go over them relatively quickly in the short time we have in this segment.
Yeah, and the other 3 modules in DBT is stress tolerance. How do we tolerate the stress when life is hard? The next module is called emotion regulation, and it just teaches skills. How do we regulate our mood? How do we build a lifestyle that's going to be emotionally healthier and create resilience and be less vulnerable to really strong emotions or unwanted emotions? And then the last module is interpersonal effectiveness, which just teaches us how to communicate well and have healthy relationships with people around us. And all of those things are really important for our mental health. And so those are just the 4 skill modules that are generally covered in DBT.
And how do you measure effectiveness? How do you know when you've succeeded, when the patient is done with therapy or bridges to some sort of maintenance? It's so different than the way I think that it's been so problematic in mental health, and the stigma around mental health is because, there isn't the blood test. There's not the something specific. There's not the cardiogram, the x-ray, the laboratory value that says, okay, everything's fine now. How are those measurements made?
Yeah, and one of the really unique things about DBT is that one of the modalities in DBT, in our individual DBT session, it looks different than regular outpatient therapy session where, you just think of coming in, talking to your therapist about your week. In DBT, what we do is we keep what we call a diary card, and it's not keeping a journal. It really is to track specific emotional urges and behavior. And one of these things that, they work with their therapist ahead of time is to kind of identify what are the things we're working on in therapy. And not only do they track kind of the urges and behavior and gestures or thoughts, if you haven't talked about suicide this week, you also track the skills that you're using. And so once we see, that we're reducing the urges and the thoughts, and that the skill use has increased, and not just skill use, but effective skill use has increased, these skills eventually become their default way of coping to replace, the ineffective coping that they've done in the past. And so for a child to maybe use cutting or thinking about suicide as a way to kind of deal with the emotional pain, they might end up using a distress tolerance skill instead. And how would that look like on a day-to-day basis? And so their diary cards actually give us a lot of data on how they're doing and in terms of effectiveness and outcomes.
I love it. All right. Because it obviously, I think everybody thinks about that, so, you're doing all this and how do we know it's working? So that's great to get some sense of how it's measured. We're going to go to break. We will be back. We're going to get into the subject of for the parents who are listening, the grandparents, the friends of a family that you believe are having difficulty, kind of what are the skills that they can start to do even before they seek help, before they're ready to seek help, maybe just to try to assess. They think their child may be having a problem, but they don't really know. What are the things they can be doing on their own? So a self-help conversation when we come back. I'm your host, Dr. Bruce Feinberg, and our show is presented by George Urology and sponsored by Emory Healthcare, proud to welcome DeKalb Medical to its family. Atlanta Allergy and Asthma, the largest allergy group in Atlanta. Viral Solutions, fast drive-up COVID testing in Atlanta, and now COVID vaccination. Avant Gynecology, Atlanta's GYN and surgical specialists. Pavilion Compounding Pharmacy, delivering the highest quality compounding medications. And Virtual Imaging, EBT screening for cancer and cardiovascular disease. We're live today with Emily Acker and Gaan Akers of Hillside, which provides community mental health services to children and families. Learn more at hside.org. That's capital hside.org. And join the conversation at 404-872-0750. So today we've taken a dive into mental health care, and particularly in children. This is a desperate need at a national level. Tremendous disservice to healthcare in general, to children. This need has been there. It's been there for decades. Root cause of gun violence, suicide, opioid epidemics, substance abuse, the list goes on, is mental health, and we just don't provide the care that's needed. And it's become that much more oppressive as a result of the pandemic, school closings, isolation, lockdown. And so it's a timely subject now, maybe more than ever, and we've been getting into today. And we've talked a lot about what Hillside does. Last year, they cared for 700 children and their extended families. They're getting literally hundreds of calls a week, and they're having to help navigate them to other facilities, which may be more appropriate, or outpatient care settings, and as well as taking those patients who are appropriate for their programs, which are diverse. Residential programs, daycare programs, at-home programs. And so we've got a lot of information from the folks. One of the things I wanted to do is focus in this last long segment is what can they share with the parents who are listening, the grandparents, the friends of families who they think are in trouble? What's the self-help message? What can they be doing on their own? And so, Gaan, I think you're going to take this to lead us off in terms of what can be done. And I understand without knowing more, without knowing particular situations, but there has to be kind of general messaging about the kind of conversations to have with your kids. What do you do if you're a more removed family member and you're witnessing something? What might you intervene? So what kind of guidance can you provide?
Yeah, the first thing that is helpful is to have a conversation, right? And the conversation can be scary for a lot of people who say, well, I don't really know how to talk to my kids about mental health. The first step really is to create an environment where you can have this conversation safely, where you're able to actually pay attention. So this is not a conversation, while you're cooking dinner and you're answering the phone and you're cleaning the sink at the same time, right? It's setting up a time to be very intentional about, let's check in. Let's have a conversation about how you're doing. It's always helpful, to make sure that there's maybe an area where you can talk privately so they don't feel like they, have to kind of hide from other people. So the where and the when is the first step of how we can have this conversation. The second piece of it really is to listen and listen really well. One of the things that I find oftentimes, as parents, as people who are caring for loved ones, is when people start talking, we immediately want to problem solve. We don't like to see our loved ones in pain, and we immediately offer suggestions and ways to fix it. And oftentimes that's not what's needed in the moment when a person is hurting or when a person is struggling with their mental health. And so really setting up time to listen to what they have to say, and speak maybe from just our perspective, and saying things instead of in a way that might sound accusatory, is to say, I really noticed that you've spent a lot of time in the room by yourself lately, and you're not interacting with other people. Help me understand what's going on. The tone in which we're seeking understanding, that we're seeking to listen and learn, that we would not be judging them for what they're feeling, is a really helpful way to start this conversation. And then the other piece of it, one of the skills I used to teach all the time in our parent DBT class is how to validate. How do you validate someone's feelings, without having to validate their behavior? Because they might be engaging in behaviors that we don't agree with, and their feelings are still valid. People feel what they feel, and help me understand, what's going on in order for you to feel this way. If things are just difficult, based on the way that they're thinking and experiencing the world, to try to put ourselves in their shoes and see, oh, wow, if I was thinking that and that was my experience, I probably feel that way too. And so help them understand that, we're really trying to understand what they're feeling. Is a really helpful next step. And instead of just offering solutions and suggestions, ask, how can I help? Do you want me to help? Sometimes they don't. Sometimes they just want you to listen. And just in talking about it, they're able to come up with their own solution. Just knowing that they are loved and that they're being heard, oftentimes it's a really big way and a big step in helping them. And then the last piece, especially for children, I find that helping them put words to their feeling is really helpful. Kids sometimes don't know what they feel. They just know that it feels kind of icky. And I use the word icky on purpose because they don't know if it's sadness or anger or shame or guilt or anxiety or embarrassment. They just feel icky and they don't know what it is. And so sometimes having a conversation to help them clarify what it is that they're feeling and help them put words to that feeling that they have can be really powerful and helpful as well.
So a parent may have this conversation. They may pick the right place and the right time, and they do everything correctly. but they're really worried because they're not sure how bad it is, how serious it is. Is there kind of a checklist for them? Are there certain things that they might hear that could be said that would give them insight into, oh my God, there's like a suicide risk here or something like that, that would kind of is a call to action? Like, I just can't wait. It's good that we had the talk, but that can't be the end of this. Something more needs to be done, and I need to do it.
Yeah, definitely. One of the major red flags is, if there are ever any kind of suicidal thoughts or self-harming behavior that's being disclosed, that's really when you need to engage a professional. And when we talk about suicidal thoughts, there's two types in our field. We would say, passive suicidal thinking and then active suicidal thinking, where, people are having a plan and they have kind of intentions and motive to actually go through with their plan. And oftentimes, those are people who become hospitalized so that we can keep them safe. So what we don't talk about a lot of times is kind of these ideas of passive suicidality. And what this could look like is kind of, those ruminations about, I wish, I just wouldn't wake up in the morning. Or maybe the world would be better off without me, or the people who I love would just be better off without me. I'm such a burden. The ideas of just hopeless and helplessness, but like things can't get any better, like things are just bad. Those are really big red flags for people who are starting to experience like passive suicidal thinking. That's definitely a red flag to engage help immediately.
And how do they engage help? Is that a call to Hillside, or not yet? It's a call somewhere else.
It could be for passive suicidal ideation. It could be a regular outpatient provider. It could be calling a therapist, a psychiatrist, for someone to do a further evaluation, right? Like, because we're picking up the red flags and they will need some support. And this is where the professional comes in, because there's definitely other things that need to be taken into consideration.
Right. But they don't have a relationship. So does it start with the kid's pediatrician? Where does it? Is it a call to the child, right? Okay.
Yeah, and this is the hardest part, right? Is navigating how to access mental health care. It could be calling the pediatrician to see if they have any recommendations. School counselors and social workers oftentimes have a list of people in the community that they know and trust, and have a partnership with the school. Sometimes people go online and they just start Googling, right? Therapists in my area. And that's oftentimes where, we get these phone calls from parents that are saying, hey, I need help immediately. And, we're like, oh, outpatient would be fine. Here's a list of providers in your area. If they need to use their insurance, going on their insurance panel and looking at a list of provider that way. Just like, if you're looking for a new PCP or a doctor, oftentimes, you go online, you kind of research and find who you might want to work with. So you can do that in terms of finding an outpatient therapist or psychiatrist. That could be an easy way to do it. But also in Georgia, specifically, there is a Georgia crisis and access line that is run by the state, and it's available 24/7. And it's a toll-free number. GCAL is at 1-800-715-4225, and that's a really great resource for anybody to have, whether you're just looking for some support or at the place where, I just talked to someone and they're actively suicidal. I need some help now.
Would you repeat that one more time? Repeat it slowly, just so they know, and we'll close on that because we have to go to break afterwards.
Yeah, the Georgia Crisis and Access Line, or GCAL, is at 1-800-715-4225, and it's available 24/7.
Thanks, Gaan. We're taking a break. We'll be back. One last chance to hear from Gaan and Emily. Another show near complete, wrapping up another edition of the Weekly Checkup. This hour was presented by Georgia Urology's Kidney Stone Hotline, 1-855-STONE-11, available day or night for scheduling an appointment within 24 hours. My thanks to Emily Acker and Gaan Akers of Hillside for being with me today live and really taking this Mental Health Awareness Month, which is a true injustice. It really needs to be a mental health awareness year following the pandemic, and really help all of you understand how critically important it is to understand what's going on to our children and to intervene and intervene early and talk about all the resources that are available. So, Emily, maybe just kind of do a quick summary, a little bit of the background, Hillside's history, what they do, where they do it, how people can get in touch. Take it from there.
Oh, I'd love to. Thank you so much for this opportunity. Hillside is located in Midtown Atlanta. We have been around for over 130 years with the goal of really helping children and families thrive. We do see many children struggling with mental and emotional health. We believe there is no health without good mental and emotional health. So being attentive to your children's needs is vital. We are found at our website, hside.org. And on social media, Facebook, Instagram, and Twitter, we put out a lot of really beneficial mental health and emotional health information. We also have a podcast, Reframe Children's Mental Health, where you can find a lot of good details and a lot of good personal stories from families who have struggled and overcome some real challenges with their children. So we have lots of resources. We're here to help. hside.org is the easiest way to find us, and we thank you for your time and attention today.
Thanks, Emily. Really appreciate it. Gaan, we probably have another minute or two, and I'm thinking that if you could just cover those 4 modules really briefly that make up the dialectical behavior therapy, because I think just in and of themselves, they impart a certain wisdom about how to start to think differently about your own mental health and the mental health of your children and the people you love.
Yeah, the 4 modules in the skills training for DBT is mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness.
All right. And for each of those, give me that 20-second definition. Mindfulness is?
It's paying attention and being present in the moment without judgment. Distress tolerance is how to get through emotional crisis without making the situation worse. Emotion regulation is building a lifestyle that is going to be less vulnerable to strong extreme emotions and a healthy emotional lifestyle. And interpersonal effectiveness is how do we communicate and have healthy relationships.
Perfect. Thanks, ladies. That was just great. So remember, they're coming from Hillside, and check it out online, hside.org. And so again, my thanks to Emily Acker and Gaan Akers for being live today. It is Mental Health Awareness Month. There's never been a greater need in this country. When you look at the rates of suicide, opioid use, substance abuse, gun violence, it all stems from not having a good platform of mental health that it should be part of our public health policy. So just an awareness is so important. It's a place to start. I'm glad we could do that today. I'm Dr. Bruce Feinberg. This has been the Weekly Checkup. Be well.